students. Okay, so how's everybody doing for week 3? Welcome to week 3. Okay, so today we will go ahead and we'll take our quiz, be in class, and then we'll go through the quiz. And then I want to go through some announcements I sent, one about the group project. Did everybody see the announcement about the group project? Okay, great. And this is exam 3-1 review week, right? In your announcement over the weekend, I sent another copy of the review schedule. There's 3 reviews that are going to be given this week. Wednesday with Professor Ford, they get 5 p.m. Eastern. Myself after class on Friday, so that would be at 6 p.m. Eastern. And then Professor Kershaw will do her Sunday evening at 7 p.m. Eastern. So you have 3 opportunities to attend 3 live reviews. You'll get recordings of all of them. Okay. And since you're a Monday class, when we're taking your exam a week from today, I will make sure that Professor Kershaw gets her recording up and ready so that I can post it for you guys Sunday night. Okay. And then you'll have 3 recordings. All right. This week, you also have your first set of NCLEX questions. In your week 3 module, it lists all the categories you are to select. And we'll talk about that after the quiz. So why don't we, if you've opened the quiz before now, go ahead and refresh it because it didn't actually open until 3 o'clock. So refresh the quiz. Let's go ahead and I'm going to put the access code, which is my last name, in the chat. Okay, so why don't we go ahead and get started on the quiz? Let's see, it's 3:03, 15 minutes would be 3:20. Why don't we come back at, let's come back at 3:25. Okay, so when you're done with the quiz, make sure you submit it. You can go off camera, but don't go off Zoom. Okay. So go ahead and take the quiz and then you'll see the rationales again in the quizzes, whether your answer is correct or incorrect. So hopefully that helps. And I'll be doing a lot of my teaching from the quiz rationales and then some additional information about our 4 concepts this week. Okay. And then at the end, we're going to do a case study. We'll break out into groups into a breakout room. So go ahead and start your quiz. I'm going to mute myself and we'll see you in about 15, 17 minutes. If you have any questions during the quiz, just put them in the chat, please. Don't come off mute.
Miss Marvel.
Keandra, put your question in the chat, please. Okay, it looks like everybody's done. If you could all start coming back on camera, that'd be great. Claudia, Mandira, are you there? Did everybody have a chance to look at the week 3 announcement with the PowerPoint and listen to the concept recording?
It wasn't nothing on the PowerPoint. It was just showing what we're supposed to look at the reading.
Yeah, yeah. And we're able to do your readings in the modules? Okay. Okay, let's go ahead and review the quiz. I'm going to share my screen here. Can everybody see my screen? You guys see my screen?
Yes, ma'am.
Yes.
Okay,
Yes.
thanks. Okay. So before we get to question 1, what did you learn about rural communities? What are rural communities?
So they're more like in business districts or outside of the city.
Right,
Like,
right.
It's harder for them to get to like doctor's appointments and stuff because they're so farther out.
Exactly.
You
Exactly.
can find nurses that want to come farther out to them to service them, and they
Okay.
usually share the same type of doctor, maybe like a family doctor, maybe not like a specialist.
Mm-hmm. Mm-hmm. Yep. So we know that rural communities, they're typically remote, very remote, right?
mhm.
Maybe a farm, agricultural community, very small town, very small village, right? As compared to the metropolitan areas, right? And actually, there's been a shift over the last 10 years of people moving out of the big cities into the rural areas. We often don't think about the rural areas in community nursing if you're not working in them, live in them, have family living in them. We often don't think of the rural communities. They're often forgotten, right? So what should the home health nurse anticipate about people living in the rural communities? Okay, this was a select all that apply. Okay, we know that in rural communities, there's very high risks for environmental chemical exposures, right? In particular, pesticide exposures. So we know, A, they will be much more likely to have environmental chemical exposures. We also know that they will be more likely to have complex chronic illnesses. That's a huge problem in the rural communities. They don't prioritize their primary care, their preventative care. Okay, they don't have the resources in the rural community. There's very little healthcare access in the rural community, right? And that's B. Most of them will have adequate access to physicians. They won't. In a lot of rural communities, you may have one primary care physician, maybe a nurse practitioner, right? Maybe a family doctor, and that's it. If you need care for your complex chronic illnesses, you may be traveling distances, maybe for orthopedics, neurology, cardiology. Let's say you're high risk pregnancy. You're going to be traveling to find specialists, right? So B is incorrect. Most of them will have adequate access to physicians. They won't. Okay, another factor about rural populations is most of them will have employer provided insurance. That's not true. A lot of jobs in the rural communities are maybe daily paying jobs, hourly paying jobs. don't come with health insurance, dental insurance, vacation days, personal days, sick days. And that's one of the barriers we'll talk about with the rural population, and one of the reasons why they don't seek out care, right? A lot of them can't afford to lose a day's pay.
Mm.
Okay. Let's look at the rationale here. Need to move you guys over here so I can see it. There's a lot of vulnerability. Oh, by the way, are you enjoying the rationales in your questions?
Yes.
Yeah. Yep. Make sure you use these rationales, or at least go back and review them when you're preparing for the next exam, for the first exam. Right? Because a lot of general information about these concepts are in these rationales. Okay. And you have access to go back and look at your 2 quizzes and all the rationales. So use these rationales in addition to your readings and your concept recordings. Okay. So we know that rural populations are very, very vulnerable. Okay. They tend to have the high proportion of residents that are younger than 18 and older than 65. That's a fact. Okay. Residents of rural populations tend to have fewer years of formal education and far few college degrees. Incredible that more than 1/4, 25% of rural populations live in or near the poverty line. And that translates into upwards of 40% of rural children living in poverty. Okay, most of these at-risk children are from racial and ethnic minority groups, single parent families, especially when the head of the household is a female. Very few residents have insurance, health insurance, or adequate insurance to meet their needs. There's much more high-risk occupations in the rural community. When you think about agriculture, forestry, mining, those are very at-risk occupations, very high risk for injury, trauma, accidents. Rural residents are much less likely to prioritize their health. I already said that, and engage in preventative activities. All right, they're more likely to smoke, have higher rates of alcohol, substance abuse, obesity, much less likely to engage in screenings and wellness visits, whether that be blood pressure checks, cholesterol checks, screenings, colon screenings, pap smears, mammography. And as I've already stated, they're much more likely to have chronic illnesses. Chronic illnesses in the rural community is a very, very big issue. Chronic illnesses, the most common, COPD, hypertension, arthritis, type 2 diabetes, and cancer. Incredibly enough, 50% of rural adults have been diagnosed with at least one of these chronic conditions. And that compares to half of that, 25%, in non-rural communities. Those are pretty incredible numbers. We know that rural adults obviously tend to have poorer health, less likely to seek medical care, less likely to have health insurance. Definitely don't have access. There's access to fewer physicians. And in your reading page, in your module on rural populations, there's a few charts that show where the shortages are of personnel, healthcare personnel. Did you see those? Mental health, primary care. It's estimated that only 10% of US doctors work in rural areas. Okay. When they get sick, more difficulty maintaining independence because distance between home and various services and institutions. It's harder for them to travel. One of the big barriers, and we'll go through this when we go through the reading page, is transportation. Okay, and another big barrier is lack of services. So that's kind of an introduction to the rural community. Okay? Any questions? So the nurse is developing a tertiary prevention program for members of the rural community. What's tertiary in this group?
Treatment.
Treatment. So what's the right answer?
Diabetic
It's gonna
foot care.
educate,
Right.
yeah.
And why is A correct? Why is A tertiary?
Because they already
Because-
have the diabetes. so they need to
Exactly.
be
They already
educated on
have
the
something.
care.
Exactly. And again, in your rationale, I put from last week, just an or reintroduced what primary is, what secondary is, what tertiary is. You got to understand the difference between these three. In all three of your exams and the HESI, there are several questions about primary, secondary, and tertiary. Okay, what is B? What's B? Primary, secondary, or tertiary?
Secondary.
Primary.
Primary.
Primary,
Why is it primary?
because you're providing like information,
Okay,
You're
Treatment.
preventing, it's preventative.
preventing.
exactly. Right, you're providing information on how people can minimize excessive pesticide exposure. So you're trying to give them information to prevent something before it happens, right? What's C?
I'm sorry. You
Secondary.
said,
Oh, go ahead. Go ahead,
I'm
Brittany.
sorry. You said provide information. Mine is mixed up. I'm sorry.
That's
So
okay.
provide information was the preventative,
Correct.
was the primary. Okay, mine is different. It says blood pressure first, then that one. Okay.
Got it?
Yes, ma'am.
Okay. All right, because if you don't, let me know. We gotta
No, I
we gotta
got
get
it. It's
we
just
have
the
to
way
get
it's
you
lined
sorted
up.
out if you don't understand it.
I
Okay.
got it now.
All right. What is C?
Secondary,
Because
Screening.
because it's screening, secondary is screening.
right. And remember in secondary, I know S for S, screening, but remember secondary is early identification. We're screening early. That's why we do mammographies, right? Early
So,
identification.
I'm
Early.
sorry.
Go ahead.
I chose, okay, so at first I put A, but then I wouldn't put C because I felt like when it said educate, I was thinking that was kind of like primary, like, trying to prevent the problem.
Ah, Kendra, I talked about this last week when I talked about primary, secondary, and tertiary. Why do we have to be careful of the word educate when we're applying it to primary? Why is educate not the word we want to pick out for primary? Because education happens at all three levels, right? Remember that conversation last week?
No.
So, Keandra, we're educating at the primary level to prevent. We're also educating at the secondary level because let's say we screen and we early identify a risk. Well, we then have to educate about being at risk and how to reverse that risk, right? And then we educate at the tertiary level as well, right? And that's what we're doing with the answer A. We're educating on how to care for diabetes related foot care. All right, so education doesn't necessarily mean primary, it means all three. Keandra, does that make sense?
Yeah.
Okay. All right, so we determined that C is secondary, right? Screening, early identification, early treatment, early intervention. What's D?
Secondary,
Because
'Cause
Screening.
it's screening
Screening.
also.
right? And your rationales, once again, go through the definitions of primary, secondary, tertiary. So before we go into exam 1 next week, there are questions on primary, secondary, and tertiary. So if for some reason you're still confused, please let me help you. Okay? Please let me help you. Go ahead, Claudia.
I have a question. So you just said C was, you said secondary?
Yep. Screening.
What do you, is our test different? Because for me, C is not C, D. What did you say D was?
Organize a blood pressure screening at the local mall.
See, mine, for me, C is organized blood pressure and D is provide information on minimizing excessive pest exposure.
Okay.
Yeah, it's just in a different order. I think all of our tests are in different orders.
Yeah, that's why it's just throwing me off. I'm looking
Okay.
like, wait, what? Okay.
Well, that's okay if they're in different orders, as long as you have the correct answer, right?
Oh yeah, I
Yeah,
got it
that's what I
right.
was
I just
saying.
want to
I
make
just got all over
sure
the
Okay.
that I
place.
understand
Okay.
what you're going over with us, and that
Okay.
I'm understanding each one of them right
Okay.
for
All right.
future. Okay.
All right. Let's go to question 3. This is kind of an introduction to migrant farm workers. So a migrant farm worker presents to the migrant outreach clinic. They're complaining of abdominal pain, nausea, vomiting, diarrhea, skin rashes, eye irritation, throat irritation, difficulty concentrating. Which nursing intervention is appropriate? What do we learn about migrant farm workers and what are they most at risk for being exposed to?
Pesticides.
Pesticides. Okay. So what are these signs and symptoms of?
Pesticide
Exposure to
exposure.
pesticides.
Pesticide exposure.
Mhm.
Okay. I want you to, well, before we get to the rationale, okay, we wouldn't request a physician's order for an antihistamine, right? Because we're not
Right.
treating, right?
Right.
We wouldn't complete a tuberculosis symptom screening questionnaire because that's not what these are signs and symptoms of.
Right.
And evaluate other family members for signs of conjunctivitis. Well, yes, they have some eye irritation. However, they have a lot of other things going on. Okay. And what we know, what you should have connected was thinking when you're reading questions, who is the population? This is questions in general. Okay. Who is the population we're talking about? Well, here it's the migrant farm workers. Okay. So we know that they have high risks of pesticide exposures. What I want you to understand is the difference. You have to understand the difference. You're going to get asked about this in the exam. Okay, the difference between acute and chronic. You're going to be given a scenario of somebody, just kind of like this question, somebody presenting with what, whatever. Is this acute or is this chronic?
Acute.
Acute. In this case, it's acute. Okay, but let's say you are presented with a scenario where somebody was diagnosed with, they've been exposed to pesticides for years, a couple of years, 5 years, 10 years, 2 years, and they develop cancer. That's a chronic exposure, right? Because it's
Mhm.
over time. And look at the difference. Look at the difference of the signs and symptoms. And again, these are clinical questions, right? You're in the clinic. You're in that rural health clinic. Somebody presents to you with acute symptoms or chronic symptoms. You have to be able to figure that out. So look at the stark difference in the signs and symptoms of acute and chronic. So please know that. With chronic, so exposure over time, at risk for birth defects, cancer, blood disorders, neural problems, maybe reproductive issues, Parkinson's-like symptoms, reproductive issues, like I said, infertility, sterility, maybe some liver damage. Those are chronic signs and symptoms. Okay. Okay. again, in this question, who is the population? It's a migrant farm worker.
Mhm.
Okay. Nurse is doing a home visit. They're living in a very small house with several other people. So the population is the migrant farm worker. The scenario is living in a small house with lots of other families. Then the question becomes, which nursing assessment is priority?
TB
So
exposure.
it's a very specific question where maybe other answers. This is a good example of a question. I like to do my kind of exam prep as I'm doing quiz questions. Okay, this is an example of a question that, and it's not a select all that apply, that maybe another answer looks like it could be right too. Right? So what do you need to do? You got to go back and reread the question to see if there was a word that you missed, a really important word. And in this case, it would be priority. Does that make sense? So what's the priority here? What do we know about the risks of migrant farm workers living in small, very small homes that are very crowded? What is a risk?
TB.
Tuberculosis.
TB.
Exposure.
Exactly. So obviously the correct answer is a TB symptom screening questionnaire. Okay. So let's look at the rationale here. When migrants arrive to a farm to work, they may find that housing is not available or that it's very substandard, right? Maybe a lack of sanitation is an issue, structural defects, mold, lead, broken appliances, lack of climate control. And some of our migrants even live in tents or cars, right? When housing is available, it tends to be very overcrowded, which contributes to a few things or contributes to the risk of a few things, primarily TB, GI issues, and hepatitis. If they're living in older houses, that certainly is a potential for an exposure to lead. And a lot of times the housing or where these migrants are housed may be right on site, right to where they're working. So that's going to certainly increase the risks of exposure to pesticides and herbicides, right? Okay, questions on that? Okay, question 5. Now we get into poverty. It's a poverty question. Remember, that's one of our concepts this week. Rural populations, migrant farm workers, homelessness, and poverty. Okay, which statement reflects the impact of income on health outcomes? Select all that apply. Okay. Well, we certainly know that low income or living in poverty increases the risk of chronic illness, correct?
Yes,
That's pretty
ma'am.
obvious. Low income poverty reduces attendance to wellness visits, right?
Correct.
Absolutely. So therefore, C is definitely not a correct answer, right? That's incorrect. And we know that low income does not improve health outcomes, right?
Right.
So let's talk about poverty. We know this is really an introduction to poverty. We'll get into it when we pull up the PowerPoint, but poverty leads to chronic stress, mental health issues, high risk for chronic illnesses, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, more significant disability related to chronic illness, higher rates of hospitalizations. Complex health problems lead to high healthcare costs, which leads to much more difficulty, right? Sometimes often leads to bankruptcy. One of the, this is a fact. You can do an assessment, your assessment of the health of an individual, the health of a family, the health of a community is directly related to the economic impact. Okay, so if you have an individual that is living in poverty, that affects everything. If you have a family living in poverty, that affects everything. Community, let's say you have a community as a whole that lives in poverty. Okay, the health of a person, family, community is really dependent upon whether they live in poverty or not. Healthcare access, education access, nutrition access, literacy access, right? People living in poverty often they don't have the ability to pay for their health care. A lot of them don't have insurance. A lot of them live in areas where their health care is not even available. They can't afford to take the day off work to travel. Okay, low-paying jobs typically don't provide health insurance, right? Therefore, potentially reducing attendance to wellness visits. Okay. Okay, what should the nurse anticipate for a family living below the federally defined poverty line? Below.
Yep.
Okay, obviously, we anticipate poorer health outcomes, right? Compared to those living above the poverty line. They're definitely not unchanged. They are changed. We do have poorer health outcomes. Okay, so B is totally not correct. And a family living below the poverty line, C, is certainly going to have increased vulnerability due to the lack of insurance. Health insurance, dental insurance. And a family living below the poverty line, D, is obviously going to have increased vulnerability due to fewer community resources. Or excuse me, increased vulnerability. Okay? So the rationale is just about how you develop how the poverty threshold is developed, right? So poverty is defined by the federal government as various state governments for the purpose of programs qualification. Okay, this is from 2021. Family making 24/3 is at the federal poverty line. Okay, those programs for those living in poverty, such as TAM, maybe public housing, food stamps, Medicaid, WIC, these are just some of the community resources, Head Start program. These were all implemented based on levels of poverty. And the sad thing is, let's say you're living just above the poverty line, just above it, right? You no longer qualify for those, right? Putting individuals, families, communities in very vulnerable situations, right? Poverty affects everything. Okay, which client is at risk for which client is the highest risk for developing adverse health outcomes due to poverty? What's the important phrase in this question to pull out?
The highest risk.
Highest risk. It's not to say that all four of these don't have some kind of risk. But the question is asking, who has the highest risk? In reading about poverty and preparing for class today, who is the most vulnerable population when it comes to poverty?
The 15-month-old without
Kids.
medical history.
Yeah.
The children.
Kids in general. Okay, they are the most vulnerable. So a 15-month-old without a medical history creates quite a challenging situation. Right? You don't know if they have any vaccinations. You don't know if they have any kind of adverse reactions to medication. Let's say they show up at your clinic without a history. That puts child and the family at much higher risk. We know that kids are at the highest effect. Kids are at the highest risk for poverty. Okay. Lack of adequate nutrition, potentially poor brain development, exposure to environmental toxins, at risk for trauma, at risk for abuse, at risk for low quality daycare or care in general. These kids in poverty have more chronic diseases, more nutritional deficiencies, more growth issues, growth and development, developmental delays, may have higher incidence of blood lead levels, more infections. And they are usually stuck in this poverty cycle due to the decreased opportunities for education. I saw this in the schools over and over and over again. The families that lived in below the poverty line, or the families that were homeless, the effects to the kids were profound.
And they can't advocate for themselves either.
Exactly, which is why they're the highest risk group. Again, it's not that all these others are not, 44-year-old working on a farm. While a farm produces risks, 19-year-old with a history of asthma produces risk, right? Type 2 diabetes produces risk. But this child with no medical history produces a greater risk, right? So again, if there was two answers that you were looking at, well, maybe this 68-year-old, because they're elderly, and elderly is typically at risk as well, right? Go back to the question, what did you miss? You missed who has the highest risk. It didn't just say who's at risk, who has the highest risk. So be careful with these questions. Okay, read them thoroughly. Let me ask another question about exam taking. Do you guys use the highlighters that's provided in ExamSoft to highlight these important words or phrases or information in these questions? You should use the highlighter, right? Because on your first go around, when reading the question, I'm assuming everybody reads the question twice, and the first go around, you should be highlighting what pops out at you in these questions, right? And the other, I think students have called it the eyeball, where you can cross out answers, right? I would highly encourage you to use those two resources, the highlighter and the eyeball, to cross out answers. So that way, when you go back and read the question the second time, you've already highlighted what's important in the question, and you've already eliminated one or two answers. It's up to you, but I hear from students all the time that both of those resources are very helpful. All right, which would the school nurse expect for an impoverished adolescent? So impoverished meaning an adolescent who's living in poverty. Do we all understand why the increase of unintended pregnancy is the correct answer? Okay, A is just the opposite. They have an increased risk of dropping out of school, right? D is just the opposite. There's decreased attendance to extracurricular activities. And D is just the opposite. They don't have a good use of adaptive coping mechanisms. Right? So C was really the only logical answer, right? Okay, so quick rationale. Poor teens are more likely to have below average academic skills, 3 times more likely to drop out of school, high rates of teen pregnancy, more likely to suffer complications with the pregnancy, whether it's due to lack of prenatal care, low birth weight babies, premature babies, maybe babies born with birth defects. Question 9 talks about homelessness. The last 2 questions are about homelessness. Again, what's the key word in this question? Well, who's our
Highest risk.
population? Our population is the homeless.
Highest.
The highest risk.
Highest. Okay. Why is A correct?
He lives
Because they're living
alone.
alone, they don't have anyone assisting them.
Exactly. Exactly. And all these, this whole group is at risk, right? An older child with a history of suicidal ideations, yes, that's at risk. They're in therapy. Adult with schizophrenia living in a group home setting, yeah, they're at risk, but they're living in a group home setting with other people. An adolescent with substance addiction, yes, they're at risk. They have a supportive family. But a veteran with PTSD living alone, that's the highest risk of those four, right?
When I was looking at the reading for the homeless, it was saying that people who are not like who will be at risk for homelessness will be people that are like in an unstable living situation or like let me go back to the reading because I want to make sure I say it right.
Okay.
Okay.
But yeah, they were saying that if you were like in an unstable situation, if you
Okay.
were living, if you were in any situation where you weren't in a permanent living situation, you were at risk for homelessness. So I was thinking the group home setting because when I thought of group home, I thought that's that's not long term. That's kind of mostly just temporary.
But for the
Not
moment, they're in a group home. Whether it's temporary or permanent, for the moment, they're in the group home. So that's a much safer environment than somebody with PTSD living alone, right?
Mm, let me see. Yeah, homeless persons are individuals without permanent housing who may live on the streets, may stay in a shelter, mission, single room occupancy facility, or abandoned building vehicle. And it said people may be considered homeless if circumstances force them to stay with a series of friends or extended family members, or if have been released from prison or the hospital and do not have a stable. I mean, I guess
Well, think about it. I
I would
mean,
just take it as when they said not stable housing, I just figure a group home.
well, group
fit.
home for the moment in this particular question, for them, it's their current housing. We don't know if it's temporary or permanent. The question doesn't indicate that, right? And so we have to be careful about overthinking. Okay. We don't know if it's temporary or permanent, but we know for now an adult living with schizophrenia is currently living in a group home, which is much safer than a veteran with PTSD living alone.
Oh, so the PTSD is worse than the schizophrenia,
Well,
basically.
not necessarily, but living alone is the concern, right? There's no resources. There's nobody to intervene or call for help if there's an issue, right? Where the other three in therapy, living in a group home, have a supportive family, they have support around them. The veteran does not, according to what we're reading, and not adding any information into that question. Does that make sense? Okay. Okay. So as we talk about homelessness, there's two rationales I want to read. It's question 9 and question 10. So as nurses, when we're working with the homeless population, okay, it's vital that we respect the individuality of every person. Okay, and that goes along with all vulnerable populations we're working with. Okay, we need to respect the individuality of every person, right? We know many factors contribute to homelessness, and many of us are only 1 or 2 paychecks away from being unable to maintain our housing. It's easy to stereotype, but often we're going to be wrong. And in the process, we may damage any chances we have of a trusting or therapeutic relationship, right? Remember, working with vulnerable populations, you have to establish a trusting relationship. You want these individuals or parents of maybe homeless families, you want them to be able to reach out to you, tell you what they need, tell you what's going on, right? So it is easy to stereotype, but we're often going to be wrong, and we're going to destroy that chance of them opening up to us or developing any kind of a therapeutic relationship. Okay, we can't make assumptions. We want them to tell us their story. Right? We need to learn who they are, whether it's an individual or a family. Who are they? How did they get there? Right? By knowing their story and understanding what the issues are and what their needs are, it's the only way we can help them. Right? The great majority of people don't want to be homeless. Okay? It's a really challenging population to work with. Right? But it starts with, and you'll hear me say this over and over again during class, or the term, it starts with our good communication and our ability to develop that trusting relationship. Right? And this question goes into number 10 as well. Right? So we're working with the homeless population. What might we observe? Select all that apply. And from your readings, you should have learned that all 4 of these apply. If you're homeless, you're typically living in a crowded and unsanitary environment. One of the things we know about homelessness is there's a very high incidence of substance abuse and mental illnesses and chronic diseases. Okay? Homelessness includes, this is interesting. Homelessness is not just somebody living on the street, but it also includes individuals or families staying with friends or relatives, staying in temporary shelters, staying in institutions temporarily with nowhere, that's the key, nowhere to be discharged to. Some people experience intermittent homelessness. Okay, they go in and out of being homeless. Because of these factors, it's really hard to actually estimate the number of homeless individuals we have in the country. Right? We know that homeless people are also exposed to the elements, heat, cold, crowded, unsanitary living conditions, malnutrition, lack of sleep, chronic stress, more likely to abuse substances, have serious mental illnesses, much more at risk for developing TB because of the crowded living conditions. Skin infestations is a common risk factor. Chronic illnesses we talked about. And the other thing we haven't touched upon is violence. There's a lot of violence that goes on within the homeless population, whether you're the perpetrator or the victim of a crime. Trauma is a big issue with the homeless population. Trauma is a major cause of death and disability. Gunshot wounds, stab wounds, head trauma, suicide attempts. And here's really just a mind-numbing statistic. The average life expectancy of a homeless individual is 44. 44, as opposed to 78. Let's see what I didn't cover. So I'm jumping back to the PowerPoint here. There's a lot of really good information in those rationales, really good information. Okay, so here's our concept. So migrant farm workers. Let's just cover what I didn't cover. Who are the migrant and seasonal workers? Right? So let's jump back. Migrant workers come to the U.S. to work in farms during necessary seasons, and then they go back home, which means they're moving around a lot. Right? There's typically barriers, language barriers, right? So they usually don't even know what services are available to them. And then add the language barrier to that, reluctant to go seek any kind of help, right? How are they going to communicate what's going on? How are they going to understand if they've been diagnosed with something? How are they going to understand the discharge instructions? The other thing about migrant farm workers that makes them afraid to come forward with any kind of health issues, immigration status, right? Language barriers, and they typically, another big barrier is the transportation. They typically do not have private vehicles. Female migrant workers, high risk of sexual abuse. And then think about the migrant farm workers that bring their families along with the kids. Okay, these kids, lots of risk factors, exposure to sun, bodily injury from accidents. They're out there working on the farms. Pesticide exposure. We do know that with our migrant farm workers, though, that our US food supply would literally collapse, right? Without the work that these migrant farm workers do. But yet they're kind of the unsung heroes, right? No question. It's estimated that 2 to 3 million of these workers work in our agricultural industry annually. That's a lot. Okay, we talked about the housing. We talked about very high risk for chronic illnesses. The other issue with migrants is dental issues. Not only medical issues, but dental issues, especially with the kids. Think about the kids. They're more likely not to be immunized, which brings on a whole new set of risks, right? They've been uprooted from school, so the academics are going to suffer. They're moving around. They're constantly they go to a place, do their job for a couple of months, and then may pick up and move to the next state and do another job for a couple of months. So if they're sick and they've been seen or at a migrant clinic, I think there's migrant clinics that they are eligible to go to in like 42 states. But let's say you're seen in a clinic and you've been diagnosed, I don't know, your kid's been diagnosed with asthma. What's the chances of that health chart moving along with you to the next agricultural stop? Not a lot,
Nope.
right?
Right.
There is a Migrant Health Act. Okay, it provides primary and supplemental health services for migrant workers. And these are the clinics I was talking about. Okay, there's estimated 154 migrant centers across 42 states, and it serves upwards of 3 million migrants per year. Okay. We talked about pesticide exposures. Okay, so know the difference between acute. So we went through who is our migrant worker, common health concerns, barriers, talked about that. See what I missed with rural populations that wasn't in the rationales. We went through the common characteristics. That was one of your questions. A lot of the same barriers exist with rural populations and migrant farm workers. One of the things that is pretty profound in the rural populations, it's called low literacy or health literacy. And that's not a condescending term. What it means is that because of their reduced education level, it's harder for them to comprehend instruction, okay, or communicating what's wrong, or comprehending what they need to do, or what their discharge plan is, or what their follow-up plan is. Low literacy is a really, really big issue. And I know that's addressed in your reading page for rural populations. Went through that. Rural populations have a higher infant and maternal morbidity and mortality rates, especially in areas with poor coverage. Okay, there are no high-risk OBs in rural areas. There just isn't. Okay, and if they're not seeking care till 5, 6, 7 months into pregnancy, there could already be problems that have arisen. And we're finally figuring that out way late in their pregnancy. Okay, which produces many risks in itself. Right? We talked about we've talked about all that. Types of healthcare services difficult to access in rural areas. Okay, we started talking about that, right? So your emergency rooms, difficult to access, any specialty. Like I said, neurology, cardiology, oncology, orthopedics. You're having to travel to the nearest city for those services. Hospice care is pretty hard in the rural communities, as is oncology treatment, as is home health. Okay, there's no home health agencies up in the rural areas. These nurses, these healthcare workers have to come from larger areas, and that presents a lot of issues as well. Medical reimbursement, time to travel to see one patient. The other thing that's a big problem in the rural areas is workforce shortages. It's hard to recruit to work in the rural areas. Think about it. Think about being a community nurse in a rural area. I talked to recently, I live up here in Northwest Wisconsin, which is, I'm in a very rural area. And I visited a couple of months ago the local public health department, which is like a one-room schoolhouse, old schoolhouse building. And when she went through her scope of care, I mean, they do everything. Everything. Think about it. They don't have all the resources that we have in the big metropolitan areas. Right? She's the pediatric nurse, she's the labor and delivery nurse, she's the immunization nurse. You're going to be working with everybody. The other thing, the rural populations that prevents people from coming forward, especially in tenuous situations, maybe substance abuse, mental illness, abuse, neglect, violence, is the lack of anonymity. Right? In the rural communities, everybody knows everybody's business. And that's actually a hindrance for people coming forward, especially if it's not a positive situation. Like I said, violence, domestic violence, family violence, child abuse, human trafficking, right? Much less likely to come forward proactively, right? By the time, it's very common that as these things are happening, by the time you're seeing these victims, whether it's kids, adults, whatever's going on, mental illness, substance abuse, it's in a much more advanced stage. I don't mean a stage of illness. Yes, I mean that, but also, let's say with domestic violence, the victim is usually very far along in being severely hurt, right? Before them wanting to reach out, because again, anonymity is an issue. Homelessness. We talked about the care of the homelessness in our initial approach. What that means is we talked about establishing trust, giving them the confidence that you understand where they're coming from by being non-judgmental, hearing them out, wanting to know their story. Who is affected? Who's affected by homelessness? I'm asking you, who's affected?
All types of people, children,
Everybody.
elderly.
Everybody from all walks of life, everybody from all occupations. Who's affected? Anybody can be affected. One of the things I saw in the schools during the pandemic, is from the time the pandemic started and when we took that year off from school and we came back, the number of homeless families went up dramatically. During that time, parents lost their jobs, or they had to quit their jobs to stay home to take care of young kids that were going to be at home for a year. Financial resources were drained. But there was a lot of families that came out of that pandemic homeless. And that meant living in their cars, or living with a relative, or actually living in a shelter, or actually on the street. I saw that firsthand. It was a dramatic moment when everybody came back to school to see some of the situations that had unfolded over the previous year. Risk factors. What are the risk factors of homelessness? Unemployment. What else?
Mm,
Chronic illnesses.
Chronic illnesses. Mental health issues. What else? Substance abuse issues.
mhm.
What are some other risk factors? Living in poverty.
Mhm.
It's estimated that 1/3 of the homeless population is families with kids. That's a lot of homeless children. And homeless children, you need to think of their growth and development. Maybe a homeless young kid versus a homeless, maybe adolescent, all the way up to the high school level. They already react differently to it. Very challenging to take care of this population. A lot of the times, homeless population have what we call dual diagnoses, meaning they have more than one. So they may have a mental health issue with a substance abuse issue. They may have multiple chronic illnesses. Okay. We talked about injuries and violence within the homeless population. Preventative health issues, they're not focused on preventative health issues, right? They're focused on surviving day to day. There's no talk about prevention. And where do the homeless people typically seek their health care? Why is it so expensive? That's a hint. Where do they go for healthcare?
Yeah.
Board of Health?
Who just said the ER?
I did.
I can only see 4 of you because I'm sharing
Brittany
my screen.
Robinson.
Brittany, they go to the
Yes.
ER, right? They're not focused
ma'am.
on going to the neighborhood clinics, right? They're not focused on preventative care. They get sick, they go to the ER, and usually they're in pretty bad shape, which is why care for homeless populations is so expensive, because they typically seek out their care in the ER. We know they have skin, foot problems just from the environment, exposure related conditions. In your readings, I'm going to jump to this real quick. So I want to show you this. Just going through I've covered everything in your rule. I just want to show you in your homelessness. Does anybody work with the homeless? It's pretty profound. But there's some charts down here that hopefully you took a look at. Table 1, special considerations for healthcare for the homeless people. This is an excellent chart. Special considerations for medication use in homeless people. But this is what I wanted to get you at. Resources. There's so many resources for the homeless population. So if you're working with this population, if you know friends or family that may be in this situation, I want to make sure you have a look at this resource. And then poverty. Your poverty, well-being, historical perspective, that's the first half of your page. Okay, we went through the definition of poverty and contributing factors. A definition of poverty is that federal poverty line. We talked about what are contributing factors to poverty. And interestingly, if you look at your geography of poverty, you would think it's all spread over. It's not. It's grouped in different sections of the country. Brittany's shaking her head, Janet's shaking her head. It's not everywhere. All right. Health issues, common living in poverty. Too many to name, right? There's not adequate access to healthcare, not adequate access to education, not adequate access to the resources you have. Let's say you live in an impoverished community as a whole. Okay, it says, okay, if you live below the poverty line, you have all these resources. Well, if you live in an impoverished community, you may not have those resources, right? And then we talked about effects of poverty on young kids, adolescents, and teens. Okay, so let's talk about the last question. What can we as nurses do to care for this population? What can we do? What's our job in the community?
We can educate them.
Okay. What are we going to educate them about?
About the services in their community.
Yep, exactly. Making sure they know the resources available to them. Because you know what? Everybody living in poverty may have different resources or may have different resource needs. Some may be for kids. Other individuals who are living in poverty that don't have any kids may have different resources. Maybe they have mental health issues. What are your mental health resources in the community? Maybe they have substance abuse issues. What kind of substance abuse resources do you have? Do you have detox facilities? Do you have rehab facilities? So it's all about knowing, like Janet said, it's all about knowing your resources. If you're working in the community, as I was doing in the schools, you better know what's out there in your community for resources, because everybody's going to need something to try and pull them up, pull them up and pull them out. And the effects on kids of poverty are profound. As I watched for 20 years, profound. So, okay, do you guys have any questions about the concepts we covered? Did we cover them pretty good in depth? You guys have a good understanding of these? Okay.
Yeah,
All
you
right.
did an excellent job.
Oh, thanks. Thanks. You know, when you're working in community nursing, you become very passionate about vulnerable populations. And having worked in the schools for 20 years and see what I saw, especially with kids, all the way from 3-year-olds up to 18, 19-year-olds, and the effects on homelessness or poverty or mental health issues or suicidal ideation issues, bullying, harassing. It is amazing the vulnerability that lives amongst all of us right in our own backyard.
Yes, ma'am.
And as a community nurse, you're there to help. You're to help try and lift them out of that vulnerable population. That was that whole talk we had last week about resiliency. Right? That's our goal. That's our job.
Mhm.
We need to help these hurting people become more resilient, to give them the tools to lift themselves up and out. Now think about your community. How many vulnerable people there are in your community, all the way across the lifespan, from young kids all the way up to the elderly. It's truly amazing.
Yeah.
Amazingly sad. So, okay, so here's what we're going to do next. You guys need to pull up, or somebody in your group you need to pull up the case study I sent you in your week 3 announcement. Okay, we're going to do a case study, and I believe it's a migrant case study. I'm going to break you guys up into 3 groups. Okay, it has 3 questions, the case study. It's a really good case study. Just reinforces everything we're talking about today. There's 3 questions. Room 1, if you're in room 1, you're going to answer question 1. Room 2, you're going to answer question 2. Room 3, you're going to answer question 3. So let's see, it's 3:25. I need to be 4:25. Need to be mindful of the time because we're done 10 minutes early, right? Because we don't take a break. But this is the longer class, so we have about 15 more minutes. All right, so let's split that time and take about 6 or 7 minutes in your room with your case study, and then the last 5 minutes we'll come back and talk about your answers. All right, and the case study I have has all the rationales to the answers, and that's what I'll go over with you. And actually, after class, when I send you the recording, I'm going to send you my instructor version of the case study so that you have all the rationales. They're excellent rationales. Okay? So
Where is it at in the announcement?
it's down, it's at the bottom of your week 3 announcement. And it should say week 3 case study. Anybody see it? Don't tell me I forgot to send it.
I have it.
Okay, good. I didn't forget to send it.
It's there.
Okay. All right. So I'm going to go in and so room 1, question 1, room 2, question 2, room 3, question 3. We'll stay in there for maybe 5 minutes. Okay. And then we'll come back and talk about the answers and go through the rationales. I think you'll like it. All right. So I'll see you in a few minutes. So you should all have an invitation to join your room.
multiple people are gonna be coming in and out. So I do
Mhm.
think all of them could be, but I do think C is the best.
Yeah, so do I.
So, you know, yeah, just going with the reading
I
and
could agree
stuff.
with that.
You guys figure it out?
Yes, ma'am, I think so.
Okay, good.
Yes.
Awesome. You guys done?
Yes, we are.
Okay, okay, good, fantastic. Okay, everybody's coming back in. How'd you like that case study?
It was good. I liked it.
Reinforce some of the teaching from today?
Mostly like the rural with the rural and the migrant workers.
Yep.
I mean, not rural migrant workers is what I'm trying to say.
I was asking the group if they liked the case study. Did it reinforce some of the teaching from today?
Yes.
I
Go ahead.
don't think that you sent it to me. It's not in my, I don't see it in the announcements. They said it was above the week 3, but I don't think I
Well,
have it.
It went to everybody. I sent the same announcement out to everybody. So you
That's weird.
look at the bottom. It should have been the concept recording, the PowerPoint, the student notes, the review schedule, and the case study. Do I have that right?
Yeah.
It's there. All right. Let me pull up this. Okay, this is what I'm going to be sending to you guys when I send out my recording. This has really nice rationales for the questions that support your teaching. I'm a firm believer in rationales as an excellent way of reinforcing teaching. All right, so room 1. So we have a nurse who works in public health. She's assigned to the rural health clinic, largely Hispanic population with many migrant farm workers who are primarily male. She lives approximately 45 minutes from the nearest densely populated city. So she's located within a farm, agricultural community. Many of the large farms have housing quarters known to be occupied by undocumented workers. The farms are situated within fields of grapevines and peach orchards. Sounds pretty. As a public health nurse working in a rural practice, what are some of the professional challenges? We talked about these that she may encounter. Did you guys, room 1, did you go up a C? You did.
Yes.
Awesome. Well, we talked about this. You're out in the middle of nowhere. You're the community nurse for this big rural community, right? You don't have a lot of resources, right?
Can I ask a question?
Pardon me?
What, can I ask a question? So I just had a question about the greater autonomy of practice.
The what?
The answer number D.
Greater autonomy of practice. Okay.
So would that be like, she cares, she gets to do more care for them, or like how?
Well, she's kind of it. So she
Okay.
has lots of autonomy, right?
Yeah.
She's it. Let's look at the rationale here. Some of the challenges of rural practice. So this is more of a caregiver question, healthcare worker question answer. Some of the challenges rural practice, professional isolation. There's nobody around. This public nurse I talked to up here in Wisconsin a couple of months ago, there's nobody around. Her nearest phone call to somebody may be an hour away in the biggest city, right? For a second opinion. So they face professional isolation. limited opportunities for continuing education, lack of other kinds of health personnel or professionals who they can interact with. It's them. That's it. Heavy workloads, yes. Ability to function well, and you have to have the ability to function well in several clinical areas, right? You need all your, you'll need all your peds, Jerry, fundamentals, maternity. You'll need all that. You may be practicing all of that in the rural community, right? Lack of anonymity, we talked about. And for some, restricted social life. Many nurses value the close relationships with clients and coworkers, along with the diverse clinical experiences that evolve from caring for clients of all ages who maybe have a variety of healthcare problems, right? The rural nurse is often caring for clients for long periods, right? In some cases over generations, right? There are benefits, like Sharice said, greater autonomy. You're making your decisions. Okay. And it is pretty nice living in a rural area. It's pretty quiet, right? So now she's working with primarily Mexican immigrants. What cultural health benefits and practices is she expected to encounter when dealing with this specific population? Did you guys come up with D?
Yeah, we all chose D.
Did you? Okay. All right. So here we're starting to get into different cultures. Just like the urban areas, rural areas have multitudes of different cultures. Right. So we'll be talking about cultural competence as the term goes on, but if you're working in the rural areas, you need to understand at least the basics about each culture, right? So we know, I'm looking at the rationale here. The nurse is considered, as we always are, an authority figure that should respect the individual. So in this case, the Mexican culture, be able to relate to the individual, maintain the individual's dignity. Okay, we know that Mexican individuals prefer polite, non-confrontational relationships. Okay, they may appear, let's see, at times, sympatia, individuals and families may appear to understand what's being said to them by nodding their heads, when in actuality, they really don't understand. So the nurse then needs to take measures to validate the understanding of the individuals. We'll talk about that when we talk about educator-related barriers, or barriers to teaching. Okay, yes, they're nodding their head, but how do we really know they understand? Right? Should we have them read something in their native language? How do we know that they understand? All right, Mexican individuals expect to talk about personal matters, chit chat for the first couple of minutes. They expect a nurse not to appear rushed, be a good listener. Humor is appreciated. Okay, so good job, Burn 2. Last question. You have a 48-year-old man who works in the grape fields for 12 to 13 hours a day. He's responsible for picking fruit, packing, moving crates to be picked up for delivery. Just from reading that, what are your concerns? C.
We got CDE.
We got all of it right.
Did you get all of it right?
Yes.
CDE.
Awesome. Awesome. All right. So yeah, musculoskeletal issues from all the lifting, right? Exposure, eye issues with all the dust and chemicals. And then if he's been doing this for a while, he's going to have chronic exposure, right? So maybe some skin cancer may be in play.
Mhm.
So here's a rationale. Physical demands take their toll on your musculoskeletal system. Back and neck pain, chemical exposure. Let's see, eye problems caused by exposure to chemicals, dust, pollen. Cancer is another cited but not well documented health problem for migrant workers, mainly because of their exposure. Okay. So I want to be mindful of time. We're right on time now. I hope this class was helpful. I hope they have a better understanding of these 4 concepts. Try and attend a review if you can. If not, you'll get the recordings. A week from today, we'll be taking exam 1. If anybody needs help preparing for exam 1, My expectation is I'm happy to meet with you. Happy, but you have to do your due diligence and you have to prepare adequately as well. Okay, so what I like to do towards the end, and since it's the weekend before an exam and you're a Monday class, if you want to set up some time to meet with me next weekend, after you've done your due diligence, we can determine what concepts you're struggling with. Does that make sense? So I want you to come to a session with me, a tutoring session with very specific questions. What are you struggling with? I don't want to review 3 weeks of concepts and all that if you haven't watched the concept recordings. So I expect you to do your due diligence in preparing for the exam. And then when it's all said and done, you say, oh, I'm still struggling with this. I'm really not understanding this. Set up a time with me at the end of this week or over the weekend, and we can meet for a little bit and go through what you're still struggling with. Okay. So I'm offering that up to all of you. All right. And I promise you I'll have all 3 recordings to you by Sunday night. Actually, you'll have them on the day they're done. But we won't get Professor Kershaw's till late Sunday night. But then the class is until 3. So if you want to watch her recording, you do that Monday morning. Okay. So it's good to see everybody today. Have a really good rest of your week. If you want to stay on, if you have any one-on-one questions, I'll stay on after. All right. But have a good week. It was good to see everybody. Thanks for all your participation too. I appreciate it. Okay.
Miss Marvel, would that be like a